This presentation is a teaching on Module 1, Brain Physiology. We're going to be working to understand the mechanisms of the four major lobes of the brain. They are the frontal, parietal, temporal, and occipital. Think of the frontal lobe as the front of the car, responsible for motor control and executive function. The parietal lobe is the primary sensory area, responsible for proprioception, position, pain, and pressure. The temporal lobe is all about hearing, and the occipital lobe is related to vision. When you think of frontal lobe, think of executive function. The frontal lobe has motor control and executive function, 52 distinct regions called Brodmann's areas. It's responsible for social skills, personality, and behavioral problems. When there are problems here in the prefrontal cortex, aphasia can result, and dementia is often a direct result of frontal lobe dysfunction. Understanding frontal lobe function is as simple as Flipper JW. Flexibility, language, insight, planning, prioritizing, expressive speech, reasoning, judgment, and working memory. These are the functions of the frontal lobe. Parietal lobe, think of spatial awareness, everything having to do with using sensory information. The clock drawing test is important. The CDT indicates right parietal lobe hemisphere health. It indicates Alzheimer's and other dementias. It's easy to administer, and you ask them to draw 10 past 11. The parietal lobe is the primary sensory area. It's responsible for taste, reading, and writing. Its functions are proprioception, position, pain, and pressure. Parietal lobe is capable of integrating sensory information and transforming this into sight, taste, hearing, smell, and touch. When you think of the temporal lobe, you want to think of auditory hallucinations and processing auditory information from both ears. The temporal lobe is all about hearing function. Wernicke's area is language, receptive speech, understanding spoken words, stores long-term, episodic, and declarative memories, processing emotional responses, attachment, and social behavior. When things go wrong in the temporal lobe, we will find auditory hallucinations, receptive aphasia, or Wernicke's aphasia, amnesia, both anterograde and retrograde, problems forming new memories or recalling past events, changes in memory function and behavior. The occipital lobe will be the origin for visual hallucinations and Lewy body dementia. Remember the occipital lobe, OIC. Here we find visual processing in the primary visual cortex and functioning to provide coordination with other sensory inputs for meaningful interpretation. Within the occipital lobe, you can have hymenopia, quadrantenopia. You can have blindness. There is visual hallucinations like Lewy body dementia. And for Lewy body dementia, you never give antipsychotics because visual hallucinations are just part of the diagnosis. Reviewing the lobes. We have the occipital lobe, the parietal lobe, the frontal lobe, and the temporal lobe. Remember, cerebellum is posture, balance, coordination, and brainstem is breathing, swallowing, heart rate, blood pressure. We will now move on to cover more deeply laying brain structures, the limbic system. The limbic system regulates and modulates emotions and memory. To remember the different parts of the limbic system, just remember, happy hippos take apples. Hypothalamus, hippocampus, thalamus, amygdala. Remembering the cingulate gyrus is present as well. The primary functions of the hypothalamus is managing homeostasis by controlling hormones used by the body and modulating memory and related behaviors. The mnemonic is, what heck? What heck? The mnemonic is water balance, hunger, appetite, temperature, hormones, sex and libido, and circadian rhythm. The thalamus is the sensory relay center, the switchboard for connecting all senses except for smell. The hippocampus regulates memory. It converts short-term into long-term memory and manages motivation, stress management, emotions, and learning. Remember, a stressed hippo on campus has a big head for memory. The amygdala. Here we process and manage mood and smell, emotional memories, fear, anxiety, emotions and aggression and rage. And remember, smell is used to connect with emotions. Remember, emogsmella. This brings us to the cranial nerves. Our mnemonic to remember the nerves is, on occasion our trusty truck acts funny, very good vehicle anyhow. And then to remember their function, some say merry money, but my brother says big brains matter more. And always remember, the 12th cranial nerve test is to stick out your tongue. Here you will use the mnemonic to memorize both the names of the 12 cranial nerves in order, as well as the function, whether sensory, motor, or both. A complete understanding of the dopamine pathways is essential for success at the board exam. The mnemonic, many men never travel, stands for mesocortical, mesolimbic, nigrostriatal, and tuberoinfundibular. The effects upon the dopamine pathways are differentiated primarily in that typical antipsychotics perform dopamine antagonism, while the atypicals work by 5-HT2A antagonism, providing different levels of therapeutic properties and side effects. The dopamine pathways. The mesolimbic is affected by an increase in dopamine. Hyperactivity of this dopamine serves to create positive psychotic symptoms. The mesocortical is affected by a decrease in dopamine. This leads to negative and depressive symptoms of schizophrenia with its lack of motivation and withdrawal tendencies. The nigrostriatal pathway is affected by a decreased level of dopamine, which normally modulates movement. When dopamine is down, acetylcholine levels are up, resulting in EPS symptoms. The mnemonic NST is for involuntary, stuttering, and tardive. In this pathway, there is an inverse relationship between dopamine and acetylcholine. The tuberoinfundibular pathway is also affected by low dopamine. When this happens, prolactin levels rise, causing amenorrhea and related symptomatology. There's a mnemonic for this pathway as well, TIP. This inhibits prolactin. High-yield information. The mesolimbic can also be triggered by pleasurable experiences. The mesocortical is dynamic for decision-making, memory, and focus. The nigrostriatal supports motor planning and contains 80% of the brain's dopamine. The tuberoinfundibular inhibits prolactin, thereby affecting the pituitary system. Extrapyramidal symptoms. The mnemonic for extrapyramidal symptoms is ADAPT, or ADAAPT. Acute dystonia, akathisia, akinesia, Parkinsonism, tardive dyskinesia. For acute dystonia, you're going to have spasms of the face, neck, tongue, and they're painful. You're going to have oculogyric crisis and use benztropine. Treatment, IV medications, benztropine, diazepam. Terminate or reduce the med. It might be days, weeks, or years. Causes, antidopaminergic agents, antimemetics like metoclopramide, antipsychotics like Haldol or chlorpromazine. Neuromuscular testing, range of motion, breathing ability, swallowing, speech, blood tests, tetanus vaccination, hyperventilation, hypocalcemia, hypomagnesemia, Wilson's disease, nutrients, electrolytes, and proteins. Alrighty, the assessment tools. Barnes Akathisia Rating Scale, BARS, EPS Rating Scale. All but tardive dyskinesia treatment options, beta blocker, propranolol, benztropine, and benzodiazepine. For tardive dyskinesia treatment options, not benztropine, Austedo, and Ingrezza. Decrease or change the medication. Can be caused by Reglan. acute dystonia, benztropine, oculogyric crisis, benztropine, akinesia, benztropine, akaesthesia, a beta blocker, benztropine, tardive dyskinesia, Austedo, Ingrezza. Never beta blockers for asthma. Some information about akinesia. Things to know about akinesia. Loss of spontaneous muscle movement. Treat with benztropine. Found in Parkinson's disease. Cause is often medications that inhibit dopamine release or severe hypothyroid, maybe loss of striatal neurons. It's diagnosed by motor exam, MRI, TSH levels, genetic testing, karyotyping, or ultrasonography. Remember, fetal akinesia is intrauterine growth restriction with multiple joint deformities, facial anomalies, and underdevelopment of the lungs. Fetal care. Monitor for reduced fetal movement, increased uterine size, results in stillbirth or short survival symptoms. Parkinsonian symptoms. Pseudo-Parkinsonian symptoms. D2 blockade can mimic Parkinson's disease. A patient who appears uninterested might be experiencing pseudo-Parkinsonia. Also consider that mask-like expressions could be confused with affective blunting or flattening. Pseudo-Parkinsonian symptoms. Pseudo-Parkinsonian symptoms.